Mrs. B is a 35-year-old woman who is married and has two children, aged 6 months and 2 years. She's recently a victim in a house fire, experiencing significant scarring on the right side of her face, neck, chest, and both arms. In addition to severe respiratory tract complications, she has been off work since the accident. Her husband and children were not at home at the time of the incident. It has now been 1 month since the fire, and Mrs. B is currently a patient at her local hospital. The nurse caring for Mrs. B is using Roy's adaptation model to assess Mrs. B's progress and needs. When Mrs. B's nurse is instructing her on how to properly use an incentive spirometer and the importance of deep breathing and coughing to prevent further respiratory complications, Mrs. B begins to cry. She explains to the nurse that it's painful for her to expand her chest and that she doesn't want to take her pain medications in fear of the drugs passing into her breast milk. The nurse sits down next to Mrs. B, takes her hand, and asks her how she is feeling. Mrs. B expresses that she doesn't want to be discharged, as she is fearful to be out in public. She asks the nurse what she should do about breastfeeding, as her burns do not allow her to hold her baby securely. She tells the nurse that she is worried that her change in appearance will impact her marriage and alter her ability to maintain social relationships. The nurse stays with Mrs. B until she is ready for a nap, then leaves the room to collaborate with her team on how to help Mrs. B cope more effectively with her current status of health.